Good evening, everyone, and thank you for joining this panel. Apologies about the delay there. We've had a couple of hiccups with the technology, and we've also lost one of our panellists, unfortunately, but still welcome. With this panel, we are exploring the double impact of COVID-19 on the emergency response to Tropical Cyclone Harold, really looking into what did a locally led disaster response look like during a global pandemic. And what are the lessons for the humanitarian community with regards to localisation? This panel itself is based on quite extensive research and a case study that Australian Red Cross commissioned last year, which was led by Pacific researchers in Fiji and Vanuatu. I'm Fiona Tarpey, Head of International Advocacy at Australian Red Cross, and I have the privilege of chairing this panel tonight. Before proceeding any further, I would like to take some time to acknowledge and pay my respect to the traditional owners of the land on whom I'm speaking from here in Melbourne, Australia, who are the Wurundjeri people of the Kulin Nation, and to pay my respects to the elders past, present and emerging. And in doing so, I'd also like to acknowledge there's a lot we can learn, and we've heard today already in the conference about Indigenous practice and approaches to disasters in Australia and elsewhere. We now have the privilege of introducing the rest of the panel. First of all, I'd like to introduce Rolela Nakabia, who is a researcher who's based in Fiji and undertook the research in that country for the case study. Rolela is also a lecturer at the Fiji School of Medicine. So hello to you, Rolela. I'd also like to, unfortunately, we don't have Linda Kinney with us, who was the researcher in Vanuatu for the case study. Hopefully she'll be able to join us a bit later. But we also have with us Maya Fasau, who is the manager of the disaster law program with the International Federation of Red Cross in the Pacific. And Maya has been providing technical assistance to disaster law and disaster policies in the Pacific for a number of years, with the aim of strengthening localised governance, and did a lot of work around disaster law legislation in Fiji and Vanuatu just before the tropical cyclone hit. I'd also like to acknowledge that in Suva, Suva has just recently gone into another lockdown in response to the recent COVID-19 outbreak. So a double thank you to Rolela and Maya, and our best wishes for everyone there. So the format for this session, it's not going to be 45 minutes now. We'll have to reduce the time of it, but I'll still aim to leave a bit of time at the end for the questions and answers. So it's not a lot of time. So please do post questions as we go along, and it'll prompt me to address them as we go. Firstly, a bit of scene setting from me. I was going to share a PowerPoint on this, but unfortunately I don't have access to that at the moment. But just to say that Tropical Cyclone Harold was a major tropical cyclone, a Category 5 that hit both Fiji and Vanuatu in April last year. It hit both of these countries not long after they'd put in place emergency measures in response to COVID-19. Now, the responses of both governments in Fiji and Vanuatu were quick and very robust, with the aim of isolating those islands. There were strict containment measures, border closures, domestic travel bans, quarantine requirements, curfews, restrictions on gatherings. And I should say that Vanuatu is still one of the few countries in the world that had not had cases of community transmission of COVID-19. So it was a really remarkable and rapid response. And what we're really going to explore in this session today is the impact that these restrictions had, in that most international aid workers had left a couple of weeks previously and returned to their home bases in response to the restrictions. So when Tropical Cyclone hit, there was not the usual array of international actors based in either of these countries, and nor could they fly in either in the typical sort of surge response. Both governments did request support from partners, and there was still a reasonably significant international response effort, but that was managed remotely. So it really changed the nature of the response. And it led to many commentators and respondents to the research identifying this response was really akin to a localisation window being opened up, creating a context with lots of lessons for us. And for us at Australian Red Cross, this was a really critical opportunity to capture the lessons, as we had also been on a long journey around reforming our own program model around localisation. And hence we commissioned this research led by Linda and Rolela. So now I'm really pleased to hand over and listen to some of the responses around the research from the panel. But to start off with, Maya, I'm going to start with you and say, with your experience working around governance and Pacific leadership in natural disasters in the Pacific, what did the leadership response to TC Harold actually look like, and what was different about it from your perspective?
Thank you very much, Fiona, and thank you to everyone that have tuned in today. It's a great privilege to be here. So TC Harold response, I guess, as you pointed out, findings approach. It was a very different approach to response because we were no longer being able to fly in human support, as you pointed out. However, the dividends really paid off in relation to capacity building. Speaking from the experience of colleagues that were assisting our Fiji Red Cross and Fiji Red Cross themselves, it really brought to the fore the capacity building and the investment that was done by headquarters in their different branches. And this is not just branches on or where we are at the moment, but the maritime islands. So as you pointed out, it was really localized, it was internalized. And I guess one of the other key things that really came out of this response was the capacity of the communities to actually respond and to support the capacity that is in country. There's just very high capacity, but I guess at times it's underutilized.
That's really
during this time, I guess also there was a lot of who maybe had the capacity but were a bit reluctant to support or to utilize the skills that they have or the learning that they've gathered over the years. But as you pointed out, with the lack of search support from overseas, there was internalization in terms of looking at the skills available, not only where we are here in Suva, because we were also on lockdown around the time, but also looking at outside of Suva, decentralization. So these really paid a lot of dividends, the investment in community disaster risk management and training at that level. Thank you, Fiona.
Oh, thanks, Maya. That's really interesting. And I mean, another thing that's happened in Fiji since Tropical Cyclone Harold was there's been other really significant Category 4 and Category 5 cyclones hit with TC Yasa and TC Anna. So we're seeing the frequency and the impact of natural disasters, hitting the Pacific growing. And there's a lot of attribution in there from the impact of climate change. So you've seen two subsequent responses in your country, also with the COVID-19 overlay. Are you seeing these lessons being consolidated subsequently in the last few months, or what other changes have you seen take place?
Apologies, the question was posed to me or to Raila?
Yeah, to you, Maya. I'm just thinking since the TC Harold, there's been other quite large-scale cyclones that have hit as well. In terms of localized leadership, are there other things that you've seen that are being carried through into the subsequent responses as well?
Thank you, Fiona. Yes, so definitely the lessons learned from TC Harold definitely fed in and supported to ensure processes for Yasa and Anna are more coordinated and strengthened. And of course, it was an issue that not only Fiji or Vanuatu were struggling with at the time. We've never had a pandemic of this level or this proportion affecting our processes and our procedures in terms of disaster management. But a lot of strong coordination as well as interagency collaboration and cooperation in terms of not just responding to Anna and Yasa, but at the same time ensuring that the protocols for COVID-19 were being observed. So right before TC Yasa and Anna hit, we were in the middle of a workshop for the frontline agencies in Fiji. So this is Ministry of Foreign Affairs, Customs, Immigration, Biosecurity, and DMO, Ministry of Health and Ministry of Defense, as well as the Airports Authority and colleagues from other agencies of ports authorities and such. We were in the middle of how to facilitate the expedited clearance of humanitarian assistance in times of disasters, as well as multiple disasters. And what I've been hearing from some of the colleagues are they're really, really eager to continue the discussions because they even got more lessons that they learned during YASA and ANA, but at the same time, they were really happy with the opportunity for the operational officers to actually sit down and to plan and to look at these issues because they were working side by side, day and night at the border, but they never had the opportunity to actually sit down and look at responses and look at how they can collaborate. A key issue that came out of this is disaster risk management and risk reduction is a multi-sectoral approach, and each and every sector has certain risks that they look after. So for instance, customs looking at revenue leakage or revenue forgone, as well as looking at interdicting contraband that may be coming into the country in times of disasters. Biosecurity, ensuring that while they are responding, they are not letting other flora and fauna or animal or plant diseases into the country. Immigration, ensuring that those who are being led into the country to support humanitarian action are not offenders in terms of sex offending, and they do not make the communities which are already vulnerable due to the disasters more vulnerable. And these are some of the other risk management aspects that we are really, really looking into detail right now within the Fiji Law Review, which I feel greatly strengthens not just looking at the response, but also looking at protection of the borders of Fiji against organized crime and other types of disasters that they might end up being set up for in the future.
Thanks, Mayor. That's really interesting. So it sounds like, you know, there's been a really strong consolidation in Fiji itself of the lessons learned, you know, and consolidating them in multi-staker dialogue with ministries, increased investments in other standing operating procedures, you know, further investments in disaster risk reduction. So it sounds like a really solid consolidation. And as I said a bit earlier, you know, if we are witnessing the increased intensity and frequency of cyclones in the Pacific, such critical and important work. Now, call on Ralayla, if she can. Ralayla can turn on her video.
Yeah.
Hello.
Hi.
So nice to see you. And again, thanks so much. I realise that you're all in lockdown. It must be a very concerning time. Concerning time for you. It's almost like a return to the return in that, you know,
Yeah.
you've been so successful for such a long period of time. So yeah, our thoughts are really with you there. So Ralayla, I've heard you talk about the changes, and it's really interesting about women's roles and women's leadership during the response to TC Harold. I mean, you said things like, you know, women were much more visible. Why and how do you think this happened? And I'm really interested also to hear about what role social media played in that and the changed nature of how social media was really used locally within Fiji in the response.
Thank you, Anna. Thank you for the warm welcome, even though we are on a total lockdown. And I don't know about my neighbor, Meapo. I'm here in Samambula, and Meapo, I think you're in Tamavua or somewhere in Suva. Yes. In regards to that important aspect of the research, and I find that that it's a very interesting aspect that even popped up in our findings. Women that are coming forward in taking part in humanitarian action or even community-based risk or disaster risk management assisting their co-parts or assisting their male counterparts in the village, in the community, and even showing these on social media, especially on Facebook. I even saw some on Twitter, tweeting about the success of what they have been contributing, or what they or the the tasks that they're contributing, or even the responsibilities that they're given, and gaining success in whatever areas that they're engaged in, in the communities. So for me, in encountering the double impacts shortly after the when you were on a lockdown last year, and TC Harold came on, and then we have TC Asa and Anna again, and then this lockdown, it kept on giving the women's role a big boost to continue what they were doing in the past months. I think it's something that they were built, that the training that they have been going through, based on community training, or most probably they are just they are bold to take part in the I find that they are bold, because in most of the responses, in most of interviews that we had conducted, most of them were ladies, most of them were women, coming up with plans, coming up with ideas, coming up with strategies that would better the response, even at the family, or even as a village, or even at the community base. And that does not leave out those that are in leadership institutions. There are organized forums here. One was done last week, one was done last night, and it was all women in leadership regarding disaster response, regarding the what we have now in Fiji, on how to look after each other during this pandemic. So for women's participation and voices being led out, or being aired on multimedia, on media platforms, I really support that, because it has come out strongly, and it is a big change, especially for Melanesian Melanesian communities, something that was not practiced before, Anna. Yeah.
I'm hearing similar themes to what May was saying as well, that there's been a lot of investment in preparedness in the Pacific, and there's been a lot of training in gender, but when the opportunities come in previous responses, that you haven't really been offered the opportunity to put that into practice. And I hear what you're saying was that with the access and the lack of the sort of international actors, that you were able to really utilize that training, and had the confidence and the leadership to really lead those coordination structures. There was one other part of the research that I found really interesting, was that you also talked about the important role around social protection, and that you also saw this, that the response, because it was also a response around social protection, that also brought to light, the important qualities around women's participation.
Yes, and that was one of the key issues too, in recognizing, citizen leaders, or even women that are in leadership position, to work around issues around social protection. In the research, that was obvious. We picked that up as as them being the assurance, or being the source of assurance to those that are around them, or that are living with them. We're looking at children. They come up with plans. They're living around those that families with children, those that are not working, unemployed, because around that time there were a big influx of unemployment in Fiji, and these are the things that makes our women, the women that are there in the community, and those also that are in leadership, it gives them more, it gives them a mile, it gives them miles ahead to continue with the, to continue the role to feed their family. So we're looking at the mobilization of communal resilient structures. Here we see that, something that we understand about our Melanesian communities, or even any community, we have existing social structures that are in the community, and we have women there to support the different tasks or different people that are holding key roles in these structures. So it works holistically. So for in this area, women are actually looking at all all aspects in terms of social protection. Yes.
That focus of social protection also around the COVID response in the Pacific and its impacts for women's leadership is really interesting. I've just seen now that Linda has joined us and has put her hands up. Hello, Linda. I'm not sure if you're in Villa, but I might actually throw to you now, Linda, if you can. Linda, you've been involved in a lot of research around localization, over 5 years, I would say, and also been through a number of responses, in Vanuatu. I'm really interested in your perspective again of what the local leadership looked and how it was different in terms of the experience in Vanuatu. What did the Vanuatu coordination structures look like? But I'm also interested in what lessons you think we need. What are the future lessons that still need to be taken forward from that response? So over to you, Linda.
Now, can you hear me?
I can hear you loud and clear. Welcome.
Thank you. So the coordination bit of it is that if we compare that with TC-PAM, coordination this time with TC Harold, there has been a really big improvement. With TC-PAM, I think everyone knows that there was a lot of confusion going on. So we had influx of people coming from outside, and then there wasn't any good coordination in place. Many of them didn't, especially with the local actors, many of them were looking up to these international actors to be taking the lead. But yeah, and there was a lot of confusion. But when we compare that with TC Harold, and because of COVID-19, our international actors weren't able to come. And I would say that is a really good thing. It's a positive thing because it gave our local actors the opportunity to go out and lead and able to coordinate with different partners, different stakeholders, or different organizations to work together and to find ways forward to be able to respond effectively. And luckily, we in Vanuatu, we have these different clusters that, they seem to be linking to each other. So for example, WASH, or Department of Water, links to Ministry of Health, and gender cluster is also linked to WASH. So I would say that the coordination was good in the sense that people were talking and looking at the gaps where one is not doing well, and maybe it's not the area of expertise. They bring in others to come and fill those gaps. And that also applies to our NGOs who were maybe focused only in some province. They were able to share the NFIs to other provinces. For example, K is focused in area of focus is in Tafea, but they were able to share the NFIs to Save the Children, to World Vision in Santo, where they were able to distribute that to the affected communities. And also because of the cluster system that we had, they were able to meet every week and discuss who should be doing this. And that was a really big positive thing. In terms of the gaps that we still have, because of COVID-19, we don't have enough NFIs, right? So in terms of way forward to address that, we need to start having those different warehouse, at least NFIs, where we need to keep the supplies in those different areas. So maybe have one in Sanma, have one. So Sanma is like islands from the north. Tafe is the islands from the south, and Sheva is the islands in the central of Vanuatu. So we need to have those different warehouse to put our NFIs, to store them there ready for when there's a disaster. We don't need to wait, for people here in Villa to be sending those NFIs. Already we have those in place where people just can go get the NFIs and start distributing. That is one. The other one will be which some of the government department are doing now is to train our local people, our local actors, to be the ones leading. So they don't have to just depend on people from the national levels. So train the people from the communities to be the one leading. So if we have those NFIs in these different provinces, these trained people will be getting those NFIs, and they'll be, going forward. So a good example will be WASH, the WASH department that sits under Department of Water. They are already now training. They have identified and selected people with some sort of expertise in the islands, and they have started training them, and they will be doing their own work. But when there's a disaster, they know that they are in this disaster team where they come forward and they already know what to do. So, yeah.
Thanks, Linda. I'm going to pick up on this issue around local and international procurement and NFIs, and actually head over to you, Maya. Because in your regional role in the Pacific, you could see the development of what was quite unique in the Pacific response to COVID was also the humanitarian corridor. And I wonder if you could talk a bit about what that looked like, and what was the sort of regional governance of that from the Pacific perspective.
Thank you, Fiona. During COVID-19, there was discussions of having a regional mechanism in place to support the movement of goods. And this was started by WHO, requesting the Pacific Island Forum to assist. And this was when borders started closing because of COVID-19 fears, and of course the experience of some of the Pacific Island countries with regards to measles and other measles-like diseases, outbreaks within the different countries. Out of that discussions, they formulated a group, and the group included Pacific Island Forum, the SPC, as well as the Pacific Humanitarian team, represented by, of course, WHO and WFP. And the discussions and other colleagues. And the discussions were to look at ways of facilitating movement of goods and personnel. So out of these discussions and over a record amount of months, regional protocols were actually formulated. The protocol for deployment of technical personnel, protocols were on immigration clearance, protocols also were in relation to customs and biosecurity, clearance of goods, and repatriation of foreign nationals, as well as clearance for planes and ships, medical and humanitarian aid, and technical personnel, and repatriating, of course, the nationals. So the protocols included measures for pre-travel, transit, in-country, and post-travel when they actually arrive into other countries. So with regards to the protocol on customs clearance, it followed the revised Kyoto Convention Annex J5, which provides for relief consignments in terms of expedited clearance processes, minimum information or paperwork, and also looking at recommendations for relief consignments to be duty and tax-free. For immigration, it was looking at ensuring that the processes immigration had in place were expedited to ensure that humanitarian support or health personnel coming into the country were let into the with the protocols for pre-arrival and post-arrival or post-travel being observed.
Mm. So Mayor, it does sound like a really comprehensive set of arrangements around quarantines and protocols for that, for that regional mechanism. Is that mechanism still working? Is it still going?
Yes, it's still going. And of course, there was also the disclaimer that the mechanisms were not to interfere with national processes. And part of the reason why we had that workshop in Fiji was actually to support the implementation and looking at how the protocols are working or how it can work at the front line.
Yeah, I mean, that's really interesting Pacific perspective at that sort of national level, and also the importance of the regional architecture and how those regional agencies came together to support this, really quite unique and important humanitarian corridor. It's really interesting learning. As we are actually already running out of time, I'm actually going to ask you all to do a little bit of futures thinking. So reflecting on your experience, certainly of TC Harold, the other most recent responses, and you've also talked about a lot of lessons, but is there something that you do see as a priority that you'd want to change, for the next response? But at the same time, is there something that you think that you're doing really well that you want to encourage other humanitarian actors in the Pacific to continue doing? So I might stay with you for that question, Maya.
Oh, thank you. Yes, so definitely, I think one of the things that we can improve on, especially with the localized approach, is creating an enabling environment for localized humanitarian action. So when we're discussing localized action, it's looking at sort of the facilities that we normally provide to international organizations, humanitarian organizations, and now is a great time to consider providing those same facilities, legal facilities. So talking about the customs clearances to be expedited, tax and duty free, to your local actors, your local organizations who have a proven track record of assisting government in times of disasters. And of course, as pointed out by our colleagues, pre-positioning is kind of like the name of the game at the moment within our islands because of our geographic makeup, how far away we are from where a lot of these PPEs are manufactured. So these are some of the things that we have to start looking at so that we can save the costs that some of these local actors or their partners actually put into the taxes and to the duties to pay for transport costs, storage costs, as well as looking at cleaning costs. These are some of the things that we feel would greatly benefit future action within the Pacific. Of course, pointed out by our colleagues as well, strengthening the inclusion. Women, children, girls, persons with disability, and especially not going down to the community level, hearing their voices, having them at the table in the pre-planning and also at the post-review of responses. This is very important for us to continue being on the right track and ensuring that we're going down the right track in terms of inclusive as well as all-purpose responses within the Pacific. Some of the organizations that were at the table in the formulation was actually Oceanic Customs Organization Secretariat, the Pacific Islands Immigration Directors having a lot of these other operation lines in one of these discussions is very important. And then creating the linkages between them right down to the community level. And this is with the view of having mobile clearance houses so that you don't always have to come through the international port to deliver disaster aid consignments in times of disasters. You can actually mobilize these teams to do clearance out in maritime islands to make it easier and to fast track the assistance actually reaching the affected communities.
Maya, I might have to jump in there as we're sort of running out of time, but that's very interesting, and obviously a lot of work from the disaster law perspective around those mechanisms and that consolidation there as well. I might now move to Linda with her thoughts around also the lessons learned. And I'm particularly thinking, Linda, with you've done a lot of thinking around partnerships. You know, what is it that you saw around new approaches to partnerships in the recent responses in Vanuatu that you want to continue with, but also what do you think there is room for change as well?
Okay, the room for change. Let me think. It's Fiona, can you hear me?
Yes, I can hear you.
Okay, the room for change will be that, you know, the lessons learned from TC Harold was that many organizations had to wait for funding. And as my other colleague said, the islands are like one of the reasons why transport cost is really big. So, you know, we need to have separate funding for just the response, set aside by each organization, so that whenever there's a disaster, then we don't have to be following those processes to ask for funding, follow the, you know, this funding has to be there already. Yeah. And the other thing will be that the coordination. Coming back to coordination, Fiona, because whenever there's a disaster, we have lessons learned, but we never go back to using that lessons learned. We are always coming up with, you know, we go and do a assessment, we come, we see it and waste like 1 to 3 months, and then the time we go to respond is like people are already back. So there is a really big need for us to find ways to shorten those, to shorten that period where we need to sit and do the assessment and all that. One way forward for that is if every responsible actors to have their own SOPs. And I know that Vanuatu is working on that now. Have your own SOPs and see who you link to, right? So when there's a disaster, we don't all go into the field, but we already know that this group of people will be the one going first to be doing the assessment, bring the assessment back, and the others will be acting on it. So yeah, so we don't confuse ourselves. And that goes right down to the community, where the community will also know their responsibility and not just sit around and wait for the end advice or whatever to reach them. So it's everyone's business, it's everyone's responsibility. That needs to be improved on.
Thanks, yeah. So Lindy, it's really interesting. So you focused very much on, you know, next step is, you know, localized, accessible funding without delays, yeah. And then also this need for next level down sort of subnational approaches around partnership and coordination. So, and to ensure those lessons learned get acted upon in a more sort of regular and rapid way. Really, really important reflections for us all. I wanted to go back to one question that we've received, and Maya, it's about the Pacific corridor. How was this mechanism available to regional and local non-government organisations that wanted to also provide support? And also, did you see a change in the volume of unsolicited bilateral goods or during the during the TC Harold response?
Thank you. So as mentioned, the mechanism was made available to the governments, and the governments would then make it available or negotiate not only on behalf of government consignments, but also those who the government recognizes as either charitable actors or humanitarian actors who work within the sphere. So they would have provisions within their various emergency and national disaster management laws or their health laws that would cater for these types of assistance and approvals from either their NEMO and DMO or their OECs. I guess in terms of looking at unsolicited goods, a lot of lessons was learned from PAM, as well as looking back to Winston, and there were minimal amounts of goods that were coming in that were unsolicited from what we've looked at. For ANA and YASA, we've yet to actually have the opportunity to breathe and go through a after review or lessons learned from that because of the semi-lockdown and the lockdowns that we're experiencing. But it's great to see that the countries are learning, and not just the countries, but as well as those who want to help. They are learning to be more sensitive to what's needed and the goods.
Oh, Mayor,
yeah. Assistance.
Yeah, thanks for that. So I've had a prompt that we need to wrap up now. So I'm just going to offer a couple of parting thoughts and also see if I can share my screen so that you can actually, oh no, that's not going to work. All right. I wanted to actually show you the research and the case study. But what I wanted to wrap up and say was that we've heard a lot of really practical lessons and case studies about how COVID-19, really changed the context and the environment in the Pacific to enable and support localized humanitarian action. And we also heard a bit about some, next steps around ongoing challenges and to bring some of those localization commitments down around localized coordination and funding. They're very, very practical steps, and we've heard, audio throughout this conference that we need to really move the dial on localization, much more from rhetoric to reality. I know a lot of us on this panel have been in a lot of discussions around localization, and I think now we've got some really practical steps and lessons learned and research to guide the way we all change how we operate in a humanitarian response in the Pacific. And so it's really time to step up and act on these recommendations and lessons. So I hope you've enjoyed this panel, really insightful, practical, thoughtful reflections from all of you. So to all of you, to Maya, to Ralela in Fiji, again, best wishes. Thanks so much for your participation today, and to Linda, it was great to have you on and lovely to see you, and I look forward to further collaboration and discussions around this really important issue. Thanks and goodbye.